Hi, my name is Andrew Kuykendall from Moffitt Cancer Center in Tampa, Florida. And at ASCO this year, we were able to present the primary results of the VERIFY study, which was a study looking at the use of Rusfertide, a hepcidin mimetic in patients with polycythemia vera. So this was a phase 3 randomized study where we took patients with polycythemia vera who were requiring phlebotomies and actually randomized them to either Rusfertide or placebo. And to give a little bit of backstory, polycythemia vera is really a chronic leukemia driven by JAK2 mutations, leads to an overproduction of blood cells. And in this disease, our primary focus is on reducing the risk for thrombotic or cardiovascular events. And one of the primary ways in which we do that is to maintain a hematocrit less than 45%. And historically, we've seen that in studies that if you maintain a hematocrit less than 45%, you're able to reduce thrombotic risk by about fourfold. And so one of the ways in which we do this historically is actually to give repeated therapeutic phlebotomies where we drain blood from patients repeatedly over time to kind of maintain that hematocrit goal. And unfortunately, these therapeutic phlebotomies are quite cumbersome to patients. They tie them to the healthcare system. They produce kind of fluid shifts that are poorly tolerated. Sometimes it compromises venous access. It also kind of exacerbates this iron deficiency that leads to a constellation of symptoms that be quite challenging. And so the thought process here was, can we use our understanding of how we regulate iron in the body to essentially control that hematocrit without the need for phlebotomies? And so we used our understanding of a hormone called hepcidin. And hepcidin is this master regulator of iron. And hepcidin in settings of iron deficiency is really down-regulated, allowing for iron to freely flow to the bone marrow. And polycythemia vera is this weird situation where you have kind of low iron, but also too many red blood cells. And so you actually have these low levels of hepcidin, iron freely flows, whatever iron you're kind of absorbing or taking in goes right to the bone marrow. You keep making these red blood cells. We have to give you more phlebotomies, and overall this is kind of a nasty cycle. And so Rusfertide is a hepcidin mimetic, first in class, subcutaneous injection that actually mimics hepcidin, kind of puts you in a high hepcidin state, kind of restricts iron from the bone marrow and allows you to control hematocrit via that mechanism. We saw in the phase 2 study that Rusfertide was able to almost completely eliminate the need for phlebotomies. And so we wanted to bring this to a phase 3 study with a placebo control. And so the VERIFY study was designed in a way where we had a kind of a 32-week period where patients were randomized to Rusfertide versus placebo. And we really measured over the weeks 20 to 32 whether or not patients were eligible for a phlebotomy. So the primary endpoint was the absence of phlebotomy eligibility. We had some other key secondary endpoints looking at control of hematocrit over that period of time, and really some key secondary endpoints looking at how patients felt. We had this idea that if you're able to kind of re-regulate iron, that you may be able to kind of address some of those symptoms like fatigue or brain fog, lack of concentration, these things that plague our patients with polycythemia vera. And so we looked at two key patient-reported outcomes, or PROs, the PROMIS fatigue score, as well as the MFSAF, or the myelofibrosis symptom assessment form. And interestingly, when we get to the primary results, we saw, at least for the primary endpoint, looking at lack of phlebotomy eligibility, Rusfertide was clearly able to do that and avoid the need for phlebotomy in patients treated with Rusfertide compared to placebo. We also showed in the key secondary endpoints that Rusfertide was able to maintain a hematocrit less than 45%, much more commonly than placebo, able to reduce the number of mean phlebotomies in those patients. And as I touched on earlier, with these critical patient-reported outcomes, Rusfertide was actually associated with improvements in fatigue and improvements in the MFSAF. So here we have an agent that in this study was able to control hematocrit, thereby we think impacting thrombotic risk, able to keep people from needing phlebotomies, and also able to improve how their symptoms were and improve how they felt. And so really exciting results that we were able to show at ASCO, and something that in this kind of long-term follow-up we'll be able to kind of further assess safety and long-term results from this as we look at this in parts 2 and 3. So really excited to present that data and excited to see what comes with this agent.